Hey, I'm Dr. Craig Chappell at Intuit Medical, here to answer a couple questions for you. The questions are, what are the pros and cons of a steroid injection? It's a super good question. Historically, steroids have been used to treat lots of different pains. And in my practice, I guess the pro to a steroid injection is it helps in the diagnosis of pain. For instance, if a person comes in with low back pain or non-specific low back pain, and on examination we find pain to be around or at the iliolumbar ligament or another ligament in the low back or even the SI joint or SI joint ligament, sometimes a cortisone injection or a steroid injection, cortisone and steroid are used interchangeably, would be placed into the offending ligament and or around that area, and if the pain goes away for a substantial amount of time, so in this case anywhere from 2 days to 3 weeks, we would call that a positive test, and indeed the pain generator would be the specific ligament that we injected or suspected to be a problem. So that's the pro of a steroid injection. The con is multiple things. So repetitive steroids are not good for people systemically, meaning they cause a lot of systemic processes such as osteoporosis, osteopenia, redistribution of fat. It decreases your immune system and a bunch of other things. But locally, when we place it, for instance, in tendons, such as the Achilles tendon or patellar tendon, or even in the lateral epicondyle, in the case of tennis elbow, it has a tendency to, or can have a tendency to weaken that structure to the point of tearing it. And that would be the worst case scenario, which doesn't actually happen that often, but the reality is it's not healing any tissue. It suppresses inflammation. It's a very potent anti-inflammatory, hence your pain goes away and permits increased activity without actually promoting healing, and so you're basically working on a injured ligament, tendon, or joint at that point, and so the victory is not that great. So we basically buy you 3 to 4 weeks of time. Like I said, the pro diagnostically, it helps a lot as far as pinpointing pain generators. The con, in reality, the longevity of it isn't that long, and it does have systemic side effects. The next question would be, when is it appropriate to use a steroid shot? Like we discussed earlier, diagnosing would be an appropriate time to use a steroid injection. In my practice, sometimes somebody will come with end-stage knee osteoarthritis, and we can use a steroid injection either in the joint or to block the nerves around the knee, which may give them, for instance, I had a patient come in and they wanted to go to Alaska on a cruise. They planned this for their lifetime, and they have this knee osteoarthritis flare, and they can't get around, they can't get on the boat, so they're super worried that they're not going to be able to go on the trip. So in my opinion, that would be an appropriate use of a steroid. We buy them some time, we get them to get out of pain for 3 weeks to 3 months, and that is helpful. As far as the problems with that, there aren't a great deal of problems with it other than it's not promoting longevity, but that would be the appropriate use of a steroid injection in conjunction with diagnosing problems. One more question is, when would I recommend against a steroid injection? So I work with athletes and very high level performers who oftentimes come in and want a steroid injection to be able to perform at the next event. And my conversation is, every event can't be the most important event. And if it is, we can't use a steroid injection just to get you through that event to the next one, because we're basically taking away your pain to allow you to participate on a non-functional structure, which in theory promotes further deterioration or injury to the structure. So that would be an inappropriate use of a steroid. The other times would be in tendons, especially small tendons such as the lateral epicondyle for tennis elbow or for golfer's elbow. So repetitive steroid injections can disintegrate the integrity of that tendon, which leads you basically on a spiral towards chronic pain. But like I said, there are some instances we use them. There are some instances where I recommend against them. We use steroids in our practice quite regularly for diagnosing and being very specific with pain generators. Thanks.